This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today.
Welcome to the 21st Century Man podcast. We're diving deep, chapter by chapter, into the book, The 21st Century Man.
That's right.
And today we're hitting chapter 80. It's got a pretty bold title, Wave Goodbye to ED.
It certainly catches your attention.
It does. Our goal here is to really unpack what this chapter says about erectile dysfunction treatments, specifically focusing on shockwave therapy. It's a big topic.
A really important one. And the book, especially this chapter, does a good job clarifying things.
Yeah, it cuts through a lot of the noise.
Yeah.
So let's get into it.
Okay, so the chapter kind of sets the stage by looking back, right? Back to 1998.
The Viagra year.
Exactly. Often called a sexual revolution. It really changed everything for a lot of men, gave them options.
Absolutely. And the book explains how those pills, the PDE5 inhibitors, Viagra, Cialis, those guys, how they actually work.
Right. It's about signaling, essentially.
Right.
Promoting the signals that tell blood vessels to open up.
More blood flow, more rigidity, simple concept, complex chemistry.
But here's the chapter points out pretty clearly. They work, often well, but it's temporary.
Right, just for a few hours, usually.
Yeah, and crucially, they don't actually fix anything long-term. They don't improve the underlying health of the blood vessels.
And that's the real issue for so many guys, isn't it?
Yeah.
The book really hammers this home vessel. Health is key.
It really is.
If those vessels are clogged or just not working right, you can signal all you want, but the pressure won't build up enough.
Or it leaks back out, the plumbing isn't sound, basically.
Yeah, exactly. Like a faulty valve system.
Perfect analogy. And that's where this chapter pivots to shockwave therapy. It presents it as, well, fundamentally different.
Different how?
It's described as pretty much the only treatment out there right now that's actually focused on improving the tissue health itself, trying to restore natural function.
Okay, so unlike pills or, say, injections that just work for that moment.
Right, those are temporary enablers.
Shockwave is aiming for something more regenerative.
That's the idea. For ED that's caused by poor blood flow, which is very common, the book talks about shockwave as potentially curative.
Curative. That's a strong word in this context.
It is. The goal isn't just an on-demand erection, it's stimulating the body's own ability to grow new, healthy blood vessels in the penis.
Okay, that is a totally different approach. So where did this tech even come from? Shockwaves sound kind of intense.
Yeah, the history is actually fascinating. The book traces it back to World War II. Depth charges, believe it or not.
Depth charges.
No, seriously. The energy pulses. Post-war, urologists figured out how to harness similar energy, but, focused and controlled, to bring up kidney stones non-invasively.
Wow. From sinking subs to smashing stones.
Quite the journey. Then, later, lower-intensity versions were developed. Orthopedics started using them for soft tissue healing, stimulating repair, growing blood vessels and tendons and things.
Okay, that makes more sense as a link.
Exactly. And building on that, researchers, I think, starting in Israel around 2010, thought, hey, maybe this could work for ED too, stimulate vessel growth in the penis.
And where does it stand now? Like officially, FDA approval and all that.
So the book notes the technology itself, the devices are FDA cleared for various things. For ED specifically, it's technically still considered investigational in the U.S.
Investigational. So experimental.
Well, yes and no. It means it hasn't gone through the final FDA approval process specifically for ED, but, and this is important, the chapter stresses there's already a lot of clinical research, a significant body of literature showing it works for ED.
Okay, so research is there, even if the final stamp isn't yet. What about actually getting the treatment? Is it awful? Painful? Downtime?
The description in the book sounds pretty manageable, actually. It's considered safe. Minimal discomfort is the term used.
Minimal discomfort. Right.
It doesn't stop you from doing anything, physical activity, even intimacy later that day. The procedure itself might feel a bit uncomfortable, like tapping or pulses, but not outright painful for most.
Right. And how do these waves actually make new blood vessels appear? What's happening biologically?
Okay, yeah, this is the really cool part, and the chapter breaks it down well. First, these aren't just sound waves like ultrasound, they're shock waves, meaning they have a different shape, a very rapid, sharp rise in pressure, then a quick drop. Much more intense energy delivered very quickly.
Like a tiny acoustic explosion.
Kinda, yeah. And when these pulses hit the penile tissue, they create microscopic bubbles, cavitation bubbles.
A cavitation, like on a propeller.
Similar physics, yeah.
Yeah.
These tiny bubbles rapidly expand and then collapse violently.
And that does something.
That collapse creates a shear force, a kind of micro trauma or stress on the surrounding cells. This does a couple of things. It helps break down tiny plaque deposits, maybe, but more importantly, it affects the cells themselves.
So
It increases the permeability of their membranes, makes them more receptive, and it stimulates various stem cells, fibroblasts.
the building block cells.
Exactly. But the absolute key thing it triggers is the release of VEGF,
The EGF.
vascular endothelial growth factor. Think of it as fertilizer for blood vessels.
Ah, okay. So the shockwave is like tilling the soil and adding fertilizer.
That's a great way to put it. It triggers the body's natural repair and growth signals, specifically for vessels right where you need them. The book mentions work by Dr. Tom Liu and others showing this microtrauma leads to VEGF, boosts nitric oxide production too, and gets local stem cells involved.
So you're essentially tricking the body into a targeted repair job.
Pretty much, yeah, using controlled microinjury to stimulate regeneration.
Okay, so what's the actual procedure like for the patient? What happens in the room?
Typically, according to the chapter, they'll apply a numbing cream about 30 minutes beforehand.
Okay, that helps with the minimal discomfort.
Right. Then the clinician uses a wand or applicator, kind of like an ultrasound probe. Maybe it makes tapping sounds depending on the machine type.
So they just move it over the area.
Yeah, specific areas, usually along the shaft of the penis, left and right sides, and also on the sides of the scrotum near the base.
Why those specific spots?
Treating the shaft helps generate vessels from the main deep arteries inside. Treating near the scrotum targets the pudendal artery system that feeds into the penile arteries. So you're improving the supply lines, essentially.
Got it. Any areas they don't treat?
Yeah, generally they avoid the head of the penis, the glands, and the urethra. Different blood supply, not the main erectile tissue mechanism they're trying to fix.
Makes sense.
Yeah.
And how long does one session take?
Usually pretty quick. 15, maybe 20 minutes.
And then you just walk out, go about your day.
That's what the book says. Normal activity right away. Even intimacy that night is fine.
Okay, practical stuff covered. Now the big one. Does it actually work? What's the proof?
Right, the evidence. The chapter covers this. Studies measure success in a couple of ways. There's the subjective part, patient questionnaires, like the IEF-5 or SHIM score.
That's the 1 to 25 scale thing.
Yeah, higher score means better function. And then there's the objective measure, penile duplex ultrasound.
How does that work?
They actually measure blood flow speed in the penis after inducing erection, usually with an injection in the office. So you see if the flow is physically improving.
Okay, so you get the feeling and the physics. What did the studies find?
The book highlights a key randomized controlled trial from 2012, compared Shockwave to a sham, like a placebo treatment.
The gold standard.
Yeah, exactly. And the results were pretty striking. The guys getting real Shockwave saw their SHIM score go up by an average of 6.7 points. The sham group only went up 3 points.
So more than double the improvement in function score.
Yep. And the blood flow, the ultrasound measure, it increased 8-fold in the treatment group compared to almost no change in the sham group.
8-fold. Wow, okay, that's not subtle.
No, that's a significant physiological change. The chapter also mentions Dr. Brandeis's own AFFIRM trial.
Right, you mentioned that earlier. That combined Shockwave with something else.
Yeah, with a nitric oxide booster supplement. Their protocol was once a week for 6 weeks. Over 70% responded, and the average SHIM score jumped by 5.2 points. Interestingly, that trial showed even more improvement than some studies using just one type of shockwave alone. Suggests combining things might be powerful.
Synergy. Are there bigger analyses, like meta-analyses?
Yes, the book mentions a couple from 2017 that pooled data from multiple studies. They consistently found significant improvements in erectile function scores with shockwave compared to controls.
Yep.
One found an average SHIM improvement over 4 points, which was statistically very significant. They also noted, maybe unsurprisingly, that guys with mild or moderate ED tended to get better results than guys with really severe ED.
Right, easier to repair something partially damaged than completely wrecked.
Kind of, yeah.
So it seems to work, especially for mild to moderate cases. But is it a permanent fix? Or do you need to keep doing it?
That's a really important question the book addresses. It's not necessarily a one-and-done forever fix. Think about it. The treatment stimulates new vessel growth, but your body still keeps aging. Other health factors keep progressing.
So the underlying conditions might continue.
Exactly. The book mentions a 2018 paper showing the positive effects were definitely still there 6 months later, especially if they had more treatment sessions initially, like 12 instead of 6.
More treatment, better results, longer lasting. Makes sense.
And doing additional booster treatments at that 6-month mark added even more points to their scores. So the new vessels seem semi-permanent, but maintenance helps counteract the ongoing aging process.
How often would someone need maintenance?
It varies. Some guys might need a short series every 3 to 6 months, others maybe just once a year. Depends on age, overall health, how severe the ED was to begin with.
Okay, so it's more like managing a chronic condition with periodic boosts, potentially.
That's a good way to think about it for many.
Who seems to benefit the most from this? Are there clear high responders?
Yeah, the chapter suggests younger guys tend to do better. Also, men who previously responded well to pills like Viagra often see good results.
That makes sense. Suggests the basic mechanism is still somewhat responsive.
Right. And being consistent with maintenance helps too. It's even discussed as a potential preventative treatment for guys at high risk, like younger men with type 1 diabetes or known vascular disease. Get ahead of the problem.
Interesting idea. And who is it not likely to help?
The book is pretty upfront about limitations. If the ED is primarily caused by nerve damage, like after some surgeries, Shockwave isn't likely to help much.
Because it targets blood vessels, not nerves.
Exactly. And also, for men with extremely severe, long-standing ED where the tissue might be significantly damaged or fibrosed, it might be too late. That's where the book uses that analogy.
The Thunderbird versus the rusted-out Plymouth.
Yeah, you can restore a classic car if the bones are good, but you can't bring back pure rust. Sets realistic expectations.
That's a really helpful way to frame it. So what's a typical course of treatment look like? Number of sessions. And any interactions to worry about.
The usual course is maybe once or twice a week for anywhere from 3 to 12 weeks. Total number of sessions varies.
Okay.
And yes, important point on things to avoid. The chapter warns against taking anti-inflammatories during the treatment period.
Like aspirin, ibuprofen.
Exactly. Motrin, Aleve, those kinds. And also steroids like prednisone or even steroid injections like epidurals for back pain. The idea is that inflammation is actually part of the healing and growth process stimulated by shockwave, so you don't want to suppress it too much.
Okay, good to know. What about blood thinners?
Considered safe, according to the book, doesn't seem to interfere.
And when do people typically start noticing a difference?
Usually takes a little while for the new vessels to grow. Results often start showing up around week 4 to 6. Though, the book mentions something interesting. Some guys feel an early improvement, maybe week 1 or 2.
Really? What's that about?
It might be a temporary effect from nitric oxide release stimulated by the treatment. That early boost might fade a bit by week 3 or 4, but then the real results from vessel growth start kicking in around week 5 or 6.
So don't get discouraged if there's a dip after an initial improvement.
Exactly. Patience is needed. And, the book describes the type of improvement really well with that up a decade idea.
Oh, yeah, I loved that part. It makes it so tangible. Explain that again.
So the idea is maybe a 55-year-old who needs Viagra finds he doesn't need it anymore after treatment. Or a 65-year-old, maybe Viagra stopped working for him, but after Shockwave, it starts working well again.
Right. Or even a 75-year-old who never had success with pills might find they work, fairly well post-treatment.
Exactly. It shows how improving the underlying vessel health can boost natural function and make other treatments more effective, which ties into the next section.
Combining therapies.
Yes. The book really emphasizes that Shockwave often works best when it's part of a combined strategy, not just on its own.
Makes sense. More tools in the toolbox.
Right. It details what's called a triple therapy protocol, like the one used at Brandeis MD.
Triple therapy. Okay, what are the 3 parts?
1, a nitric oxide booster supplement. 2, a PDE5 inhibitor like low-dose daily Cialis or Viagra as needed. And 3, the Shockwave therapy itself.
How do they work together? What's the synergy?
Well, the NO booster helps prime the system, maybe helps guys respond faster and longer to the shockwave, plus it has other health benefits, like for blood pressure.
Okay.
The PDE5 inhibitor, used alongside, actually helps the shockwave work better by maximizing the nitric oxide available to act on the new vessels being grown.
Ah, so the pill helps the new vessels function optimally.
You got it. And the shockwave provides the fundamental stimulus for building those new vessels in the first place. It's a really integrated approach.
Covering all the bases. Does the book mention other add-ons?
Briefly, yeah. Things like vacuum erection devices, sometimes PRP platelet-rich plasma injections, or even stem cell therapy are mentioned as supplemental options that can potentially be combined.
Wow. So reflecting on all this chapter takes a complex, maybe even intimidating topic like shockwave therapy and really makes it accessible.
It really does. It explains the why, the how, the history, the evidence, cuts through the marketing hype you sometimes see online.
Yeah, it gives you a solid foundation to understand what it is and who it might actually help.
And that's kind of the strength of the whole book, The 21st Century Man, isn't it? It goes beyond just symptom management.
Absolutely. It tackles the underlying issues, talks about potential long-term solutions, focuses on optimizing health, not just patching problems.
It really empowers you, the reader, with information to have better conversations with your doctor and make informed choices.
So while we just focus on Chapter 80 today, hopefully this deep dive gives you a good sense of the value here. We definitely recommend checking out the full book if these topics resonate with you.
There's just a wealth of information in there.
So a final thought maybe, as we wrap this up. Think about how often we look for the quick fix, a pill for this, the cream for that.
The easy way out sometimes.
Yeah. But this chapter and the whole concept of shockwave kind of pushes back on that. It asks us to consider, can we actually repair the underlying system? In this case, blood vessel health.
Focusing on foundational health, not just function.
Exactly. And improving that doesn't just help with ED, it ripples out into overall health and vitality. It's a different way of thinking about tackling problems.
It really is. Thinking regeneratively.
Well, thank you for joining us for this exploration of Chapter 80.
Been a great discussion.
Join us next time as we continue through the 21st Century Man. We'll be diving into Chapter 81, Viagra and Beyond.
Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.